Hello, my name is Dr. Roxanne Crosby Nwaobi, and I'll be presenting on my 2019 Florence Nightingale Foundation Scholarship Programme. Just a short biography. Of course, my name is Roxanne, and I'm a postdoctoral ophthalmic nurse researcher and the lead nurse for research at Moorfields Eye Hospital. I'm very passionate about improving ophthalmic patient-related outcomes through the modelling of real-world clinical data to deliver personalised medicine. I'm fortunate enough to be able to sit on the board of the Royal College of Nursing Ophthalmic Nursing Forum, and I'm also a trustee of the Glaucoma UK Association. Following on from this fellowship, I've been able to receive several awards, including the NIHR 70 at 70 Senior Research Leader, and I was also an inaugural Topol Health Digital Fellow. Currently, I am the principal investigator for an urgent public health study looking at COVID transmission among healthcare workers. That's the Siren study, and I've also done several peer-reviewed presentations and oral and poster presentations at national and international conferences. Just to touch on my experience of the FNF Fellowship, this word cloud says it all. It was inspirational, educational, amazing. It gave me time for reflection. We had lots of fun, and most importantly, it gave me hope. Hope that I can do what I thought I can do, and hope to be able to enact the changes that I wanted to do for my patients and colleagues and the wider NHS. Here I am at the Yale School of Management with my certificate. I was able to attend the Women's Leadership Programme, where we met with other global leaders as far as Dubai and Australia, and we exchanged thoughts and ideas to be able to enact changes in our organisations. While I was there, I received a visiting scholarship lecture from the Yale School of Nursing to talk about nursing and digital health in the UK. We attended the Houses of Parliament, and here I am outside the Westminster Archives Centre, and this picture of Sir Thomas More I just took because it reminded me of my A-level days when I had to read A Man for All Seasons. Somehow I ended up on the Parliament Live TV while I was listening to the Health and Social Care Committee talking about addiction, and I looked very interested, so that was very good. Here I am again with a colleague who helped me with the Eye Care Be Aware, my quality improvement project, and we are here on a Saturday speaking to a group of women from the Seventh-day Adventist faith about their eye conditions, what they can do to get screened, what are the signs to look out for, and how they can help themselves, their families, and their communities. And lastly, here I am with my inspirational mentor, Dr. Joan Myers, who's been helping me, coaching me, advising me through this program and beyond. So what's my quality improvement project? We called it Eye Care Be Aware, and I'll just take you through it. So over 2/3 of our patients at Moorfields, that is in central London, Moorfields, are self-assigned as BMAE. And we know that the Afro-Caribbean group are 4 times at risk of developing glaucoma. People of Asian origin have an increased risk of glaucoma. And in terms of diabetes, people of Afro-Caribbean have 2 to 3 times the risk, and people of Asian origin have 5 to 6 times the risk. We've also found that there's high rates of non-attendance to our eye appointments. So we thought up this program called Eye Care Be Aware, where we thought we can engage with the community to increase awareness of eye conditions and the importance of screening, to educate community site champions, and to empower the community to take control of their health and well-being, and also to liaise with other organisations to collate our resources and target our efforts. So at the top left of the screen, you'll see all the organisations that we engaged with. So Glaucoma UK, Thomas Parkinson, Vision UK, Guide Dogs, RNIB, and at the bottom of the screen, on the bottom right, you can see a picture of all the people that we spoke to, some of the leaders from those organisations, and I'm very proud to have a picture with Ruth May. She also attended our launch day. Following on from this, we spoke to several interest groups, so patients from Afro-Caribbean origin, patients from an Asian origin, patients attending the hospital, to understand what were the issues in the community and how we can assist. So some of the issues were decreased awareness of the eye condition and the health services related to eye care. And as a result, people attended late for treatment, and also if they did attend, they had a decreased attendance to follow-ups. We also found that there were socioeconomic restrictions, so people concerned about work, and if nothing's wrong with their eyes, why should they come to the hospital? Some religious beliefs, people believe that God will help them and didn't believe in Western medicine. There were lots of language barriers. Our services didn't provide the eye care literature in a translated format for patients to be able to understand, and sometimes staff were not using our translation services. There's also societal stigma involved, where people didn't present because they didn't tell their friends and family, because being seen as visually impaired, or you'll be seen as being flawed. The patients were unable to integrate and therefore not access any support. And one final thing, patients who also had a fear of the unknown. What if, finding the eye condition will affect their family, will affect their job? In terms of impact, we were able to do several things based on the information we got from our focus groups, and with the help of colleagues, we were able to develop this program. We were able to initiate support and hospital-based support and community-based support programs, where especially during the COVID period as well, these programs were taken online. But pre-COVID, we had support groups in the communities and also in the hospitals. We were able to tailor our sessions towards our BME communities and go where these people are. So churches, mosques, temples, hairdressers, community centres, and we used Zoom during COVID. We were also able to change the content of our program and the language to make it appropriate to our viewers. We were also able to go on radio stations during festivals, for example, Eid, and talk to them about diabetes and the high sugar foods. We were also able to dispel myths about that opticians only sell you glasses if you go to them, and that they're actually there to help with eye screening, and they can pick up conditions earlier on, like diabetes, glaucoma, and cataract. The content of our sessions were, about general eye care, drops, what type of treatment you may be able to have if you have certain eye conditions, how frequently to do your drops, and just monitoring of your condition overall. And most importantly, we were able to influence other colleagues and work with them to develop multilingual online education. So this is a group that's working with the colleague consultants at Moorfields, nurses at Moorfields, and also UCL. And so far, they've developed a multilingual AMD module where patients are able to click on, find a language of their choice, and go through this educational program. We were also able to engage with community leaders, looking at speaking to them in case our patients don't understand what we are saying, so therefore they'll listen to their leaders. One example was we found that most of our patients with glaucoma had a very, very raised intraocular pressure following Ramadan because they were not taking their eye drops. Because taking the eye drops, they felt a taste at the back of their mouth, and therefore it may have been perceived as breaking a fast. So we were able to engage, and colleagues from the Glaucoma UK were able to engage with the Muslim Council of Britain to produce educational material, to get a statement from the head imam that if they do punctal occlusion, so they block their tear ducts after taking the eye drops, it will be able to prevent an aftertaste. And also if they change the medication times, so pre-fast and post-fasting, we were able to maintain their medication regime, maintain their low IOP levels, and therefore not worsen their glaucoma. We were also able to feed back and give back to our community. So not just our patients, but also to our student nurses. So this is just a Padlet board from the University of Manchester, where I presented on my quality improvement project. And these are some of the comments that we got from the students, where they were able to reflect and think about how they can change practice in their own locale. Finally, this slide is a message to my sponsor. It's written out as in form of a letter, but I will also read it. So it's to Health Education England and Liz Fenton. Thank you so very much for sending me on this program. You know, I'd like to express my heartfelt thanks to you and the Florence Nightingale team for giving me the opportunity to attend this amazing program. My life has truly been transformed by the experiences, the learnings, and the forever friendships that I've gained during my time on this program. Since I've started this program, I've been the recipient of a further 3 high-profile national fellowships, the NIHR 70 Senior Research Leader, the Topol Digital Fellow, where I was in cohort 1 and the only nurse, and also an NIHR Integrated Clinical Academic Lectureship. I'm also a grant holder for a research project aimed at using a digital app to increase patient self-management of diabetic eye disease, and I was appointed a principal investigator for the urgent public health study, the COVID-19 study Siren, looking at transmission of COVID among healthcare workers, looking at natural immunity, and looking at the effectiveness of vaccine-related immunity. The opportunity to attend the Women's Leadership Program at the Yale School of Management and meet other global leaders was profound. Thank you so very much for your dedication to excellence and your keen support of the Florence Nightingale Leadership Program. And just as an add-on, when I came onto this program, I was very, very dejected in terms of my local role. I wanted to do a lot of stuff, but for other reasons, probably I wasn't qualified or I didn't exude the persona of being able to enact the job role that I wanted to do. And being able to go onto the RADA program, the Positive Image program, listen to Dame Elizabeth Anionwu, attend Westminster and attend the Yale Leadership program, all of these experiences have shaped me into who I am today, and I hope that I will be seen as one of the exemplars of this program. How you can go from where you are to where you want to be by leadership and training and mentorship. So thank you so very much to my sponsor. Thank you so very much to my mentor, Dr. Joan Myers, for taking me through emotionally and for all the advice that you've given as well. Thank you to Greta for your mentorship as well and for taking us as a cohort through this program. Thank you.